Welcome to class, students. Today, we'll be looking at a very important topic titled First Aid for Bite and Stings. So, we'll be looking at what the treatments to do or what to do whenever we're being stinged or bite by animals like scorpions, snakes. What are the management techniques we should imbibe or we should use in order for to manage or reduce the effect of the sting or bite on our body. Bite and sting from insects, spiders, snakes, animals and marine creatures occur daily. Most are not serious. Certain cases can cause severe illness or death in sensitive individuals. Human and animal bites may cause bruising, infection and tissue damage. General first aid is to wash the area thoroughly with soap and water, apply cold compress to reduce swelling, consider over-the-counter pain relievers or antihistamines. Sorry, I'll go take that again. Consider over-the-counter pain reliever for pain and itching. Seek immediate medical attention if symptoms worsen or an allergic reaction occurs. So first aid for mosquito bites. Number one, cleanse the bite site with soap and water and apply antiseptic. To cover the bite site with cold compress or calamine lotion to reduce any itching or swelling. Then take an antiseptic, that is antihistamine, to further relieve any itching or swelling. Then call 000 for an ambulance if the person begins showing signs of anaphylaxis. Mosquito bites should resolve themselves within few days. See your doctor if symptoms persist or worsen. So these are the steps to take for first aid for mosquito bites. Then general insect sting. Remove the stinger by gently scraping or peeling it with tweezer. Apply a paste of baking soda and cold cream or use a commercial sting treatment. For multiple sting, unusual reaction, excessive redness or breathing difficulty or history of severe reaction, seek medical attention. So how to treat a common mosquito bite? You avoid scratching, try an anti-itch lotion, mix up a homemade topical paste, place a cold compress on the bite to alleviate itching, take an oral antihistamine if allergic reaction occurs. So we want to be looking at different insect or animal bites with our treatment. So number one is bed bug bite. So let's move to description and treatment of bed bug. Description: bed bugs of bed bugs are flat, oval, reddish brown insects about 1/4 inch in size. Their bite may not hurt initially but often becomes red, swollen and itchy with reaction ranging from mild to severe. Treatment for bedbug: apply a paste of baking soda and cold cream or use a commercial topical treatment. We have the bee and wasp stings. In the bee we have the honeybee, the bumblebee, the hornet and the wasps. So let's look at the treatment. Description: a red swollen painful area usually with visible stinger in the skin. Treatment of this bee and wasp sting: gently scrape away the stinger using a edge of a credit card or a knife blade. Don't squeeze as this releases more venom. Wash the area with soap and water. Apply a cool cloth or ice pack. Watch for severe allergic reaction symptoms such as shortness of breath, tongue swollen, excessive sweating, anaphylactic shock, and seek immediate medical help if this occurs. So this is triggers. This is an image of a triggers. Description and treatment: It's a microscopic larva that attach to skin at tight areas like the waistbands or stalk lines. The feeding area typically becomes red and itchy. The treatment includes wash the affected area with soap and water, apply topical hydrocortisone cream, antihistamine or local anesthetic to reduce itching, that is calamine lotion too. Avoid scratching the area, the wound. Prevention: spray feet and ankles with quality insect repellent. Dimethylphthalate or flowers of sulphur can also be used in soaks around the ankles. We also have the fire ant sting. Look at the picture of a fire ant sting. Description and treatment of fire ant sting. Description: fire ant sting initially cause tiny painful red bumps that typically develop into blisters after about an hour. Treatment: apply ice pack at 10 minutes intervals for up to 30 minutes. After ice treatment, apply a soothing lotion such as calamine. Warning signs of severe allergic reactions: shortness of breath, tongue swelling, excessive sweating, the same anaphylactic shock, and seek immediate medical help if experiencing any allergic reaction symptoms. We have the flea bite. Look at the pictorial representation of a flea. Description and treatment of flea bite. Description: flea bite typically appear as tiny itchy red bumps primarily below the knee. And treatment: reducing the itching by applying ice pack. After removing the ice pack and drying the skin, apply a soothing lotion such as calamine. So most of the treatment of insect is ice pack and applying a lotion such as calamine lotion to help to reduce the effect of the bite, and it also reduces spread of the venom. This is a mosquito bite. This is a mosquito itself. So we're going to look at it from the description, how we can treat mosquito bite. Mosquito have a long proboscis snout for sucking blood and are most active in shady, low light, damp or marshy areas. Treatment of mosquito: you can use commercial sting head product designed for topical relief of mosquito bite. Commercial sting aid product that is designed for topical relief of mosquito bite. Then we have the scorpion sting. Look at the pictorial image of a scorpion. Description and treatment of scorpion sting. Description: scorpions are typically found in old woody structure, grasses or logs. You can find scorpions in an old wooden structure, in grasses or logs. And treatment applied it involves applying cold pack to the affected area, then transport the victim to advanced medical care as soon as possible. After applying cold pack to the affected area, ensure you transport or transfer the victim to a well advanced medical care as soon as possible in order to reduce the effect, in order for proper treatment. So it is important you transport the victim to a medical center, an advanced one. We have animal bite. Animal bite. Animal bite can cause infection and soft tissue injury. The most serious risk is the rabies, which can be transmitted through saliva of infected animals, including skunks, bats, raccoons, cats, dogs, cattle, and foxes. So we're going to be looking at signs of animal bite. We have visible bite marks. We also have bleeding. Bleeding is an example of animal bite and visible bite marks. First aid treatment of this animal bite include cleanse the wound thoroughly with soap, flush well with water. You can cover with a sterile dressing, immobilize the injured limb if appropriate, then transport the victim immediately to a medical facility. Thank you for listening.